A recent surge in acute and severe hepatitis cases among young children has some growing more concerned.
Hepatitis is just a general name for inflammation of the liver. So this is a type of hepatitis that can be caused by a virus.
The Centers for Disease Control is researching a possible link between hepatitis and adenovirus, which most commonly causes respiratory illnesses. While medical experts try to explain the sudden outbreak, Dr. Carrie Firestein with Allied Physicians Group wants to reassure parents there's nothing they need to do differently.
If their child seems really sick, because somebody with this type of hepatitis would be really sick, then they need to talk to their doctor, which is something they would do anyway.
According to the World Health Organization, at least 169 cases of acute hepatitis among children across 12 countries has led to at least one death and 17 liver transplants. So far in the United States, there have been 9 cases of severe hepatitis among kids in Alabama. 2 cases have also been reported in North Carolina. Children affected range in age from 1 month to 16 years old. Symptoms include stomach pain, diarrhea, vomiting, jaundice, and increased levels of liver enzymes.
If your child is jaundice, if their eyes are yellow, you would be going to the doctor, and the doctor would be doing that test.
Health officials in the UK have ruled out the COVID vaccine as a possible cause, with none of the British cases so far having been vaccinated because of their young age. None of the cases in the United States were among vaccinated children either. Keeping your distance from people who are sick and washing your hands are 2 ways doctors recommend protecting yourself. Jody Goldberg, Fox 5 News.